Good morning. My topic for the day is deciphering the conundrum of aerosolization during non-contact tonometry. So we all know that there are rising number of cases of COVID-19 worldwide, and this pandemic has set us aback over the past 2 years. It is also well documented that COVID is usually spread through aerosols. The aerosols which are spread could be in the form of either droplets or micro droplets and spread freely to the population. It has been documented and the papers have been published regarding the same. We also know that non-contact tonometry is a daily OPD procedure which is used worldwide for IOP screening in all cases coming to our OPD. In a paper published in 1981, it was by the group called BRIT. It was shown that microaerosol formation is produced when a non-contact air puff tonometry is performed. And based on this, the guidelines of many different bodies, including the AIOS, had suggested early last year when the country went into lockdown that NCT should be avoided in patients. So our research question was, are aerosols produced during non-contact tonometry? We collaborated with the fluid velocimetry team for the IISc Bangalore, which has recently been rated as the #1 research institute in the world. So what we did is a procedure known as frontal lighting or a shadowgraphy. We used an ultra high resolution camera which captured to 20,000 frames per second, a high intensity strobe light. We used the Shin Nippon NCT, and this is a image of the exact setup what we used. We used a technique which is known as shadowgraphy, in which with a combination of a high resolution camera, we can image particles of size between even 10 to 30 microns. We also, in our second arm of the study, used a fluorescein setup in which we used a Nikon DSLR camera, a blue LED light with a light source of 450 nanometers. And this is the photo of the fluorescein stained eye. And also a night mode in a Realme camera with a 4K resolution was also used. Now, NCT was performed in normal eye conditions after installation of 1 drop of a lubricant and after installation of 2 drops of a lubricant. Now, what were the results of our study? In normal eye conditions, if you see here, this is a shadowgraphy view. There is absolutely no aerosol generation. This experiment was repeated in 10 different subjects. The same has also been captured, if you see here, on a smartphone in the nightscape mode, in the DSLR, and in a high-speed imaging. After that, we instilled a drop of lubricant in all the 10 patients, and we reconducted the same experiment. Here we see that there is a single droplet, a single amount or minimal amount of aerosolization is seen following a drop of lubricant before the NCT being performed. And the same was also captured on fluorescein in the nightscape mode. We went on and performed the same experiment after installation of 2 drops of the lubricant. Here we could see copious amount of aerosol production, which also traversed back to the NCT port. The same experiment again was performed after installation of 2 drops of the lubricant in a nightscape mode too. And these were our findings again. You could see how profuse amount of aerosolization is being, and which can see that the droplets have reached back to the NCT port too. We also used mathematical modeling, and we've tried to find out the distance which these droplets could traverse if we were in a room with an AC on or in a low airflow room. So what was the conclusion of our study? We concluded that no aerosols are produced in normal eye conditions, so NCT can safely be performed in the OPD. There is a mild splatter of aerosol observed on 1 drop of installation, and hence NCT should be avoided in watery conditions immediately post-op. Profuse splatter of aerosols is noted on installation of 2 drops of a lubricant, and NCT should not be performed post-drop installation. And finally, there is contamination of the NCT may occur in cases of profuse aerosolization, and hence regular disinfection should be performed between two patients. So what new does our study add? Our study was one of the first to use shadowgraphy and high-speed photography to demonstrate aerosol generation. It was the first study to demonstrate that no visible or invisible aerosols are generated during NCT in normal eye conditions. And it affirms that NCT should only be avoided in conditions with watery eyes. Thank you.
Thank you, Dr. Nikhil, for a wonderful presentation. It's really innovative. I have just one question: that which lubricant was used, and what was the time difference between using the lubricant and taking the reading?
So we used a normal teardrops in all the patients.
No, it is 0.5%, 1%, or polyethylene glycol. So many lubricants are there with different viscosity, and they travel a different distance.
Yes, sir. So what we did was we used a 1% CMC in all the patients, and yes, sir. And it was used and after 10 seconds of installation of the drop in the eye, then the procedure was performed. And even in the paper, if we see, which was published by Britt in 1981, which on basis of which the guidelines were formed, they only captured everything using fluorescein staining. So during fluorescein staining, we have to instill a drop of paracaine, and due to which there was a profuse amount of aerosolization. But as was the first study in which when we put no drops in the eye whatsoever, we found there was no amount of aerosolization being found post the NCT procedure.
Okay. Questions from the judges, please.
Please proceed with the second presentation.
Thank you, Dr. Balakrishnan, for